Recognizing the symptoms of this endocrine disorder is not so easy because diabetes affects the functioning of the entire body. However, this list will help you navigate the problem and take timely action if something goes wrong. Diabetes is a serious endocrine disease characterized by elevated blood glucose levels and impairments in its delivery and use in the body. It requires prompt diagnosis and proper treatment, otherwise, serious health complications may occur. Recognizing the symptoms of diabetes early is critical because early detection allows for more effective treatment without missing out on opportunities to restore nerve endings. If left untreated, diabetes, which disrupts the functioning of several systems, can lead to serious complications such as heart disease, stroke, kidney, and nerve damage. Diabetes ranks 8th on the list of diseases causing the most deaths worldwide. Subscribe and like, let's go! While there are several well-known symptoms of diabetes, there are also less obvious ones that may prompt you to seek medical help. Here are some of them. Slow healing wounds. An increase in skin infections and cuts that take a long time to heal may also indicate diabetes. In this case, skin regeneration slows down, since the delivery of necessary substances to the affected area may be disrupted. Tingling or numbness in the extremities. Tingling, numbness, or other painful sensations in the legs, or less commonly in the arms, may also indicate diabetes. If your arms or legs were not squeezed and such sensations occur for no apparent reason, you should consult a doctor. Tingling and numbness in the extremities can be symptoms of a number of other dangerous conditions, and in diabetes they occur due to nerve damage. Itchy skin. Diabetes is characterized by dry and uncomfortable skin, which can become inflamed over time. This is because the body excretes large amounts of water and loses fluid due to elevated blood sugar levels. The skin becomes dehydrated, dry, rough to the touch, and easily damaged. Blurred vision. If your vision suddenly becomes less clear, it could be a sign of diabetes. These changes may occur due to elevated blood sugar levels, but once the blood sugar levels drop, everything should return to normal. Fatigue and weakness. Although this is a symptom of many diseases, pay attention to it. People with diabetes often experience increased fatigue because when sugar can't get into cells to provide energy, it builds up in the kidneys, which have to work harder to flush out the excess sugar. This process may cause the patient to feel unusually tired or weak. Symptoms of depression or increased irritability. If everyday tasks tire you out, it could be a sign of diabetes. Increased irritability and depressed mood may also indicate the presence of this disease. Pay attention to your psychological state and draw conclusions. Increased appetite. If you eat more than usual or don't feel full even after eating a large meal, this could be a sign of diabetes. When your blood sugar levels are not maintained at normal levels, your brain may send conflicting signals about the need to eat, mistakenly indicating hunger even though you have eaten enough food. Constant thirst. If you feel thirsty even after drinking plenty of fluids, you may have diabetes. If you drink more than 4 liters of water a day and still feel very thirsty, it is unlikely that your blood sugar levels are too high. Pay attention to this symptom. Frequent trips to the toilet. Many people ignore the increased need to go to the toilet, considering it a natural consequence of aging. However, this is actually a common symptom of diabetes and should not be overlooked. The average person should use the toilet 4 to 7 times a day. If you do this more often, it may be a sign of increased stress on your kidneys, which are trying to remove excess sugar from the blood. If you wake up several times during the night to go to the toilet, this could also be an early sign of diabetes. Urinary tract infections. In addition to an increased urge to go to the toilet, you may notice more unpleasant consequences in the form of pyelonephritis, cystitis, and other urinary tract infections. Diabetes mellitus often becomes the background for the development of infectious and inflammatory diseases of the genitourinary system, and this should be kept in mind. Remember, if you suspect you have diabetes, it is important to act quickly. In this case, proper nutrition, regular physical activity, constant monitoring of glucose levels in the blood and urine will help you lead a normal life without experiencing unnecessary discomfort. Be healthy. Until the next videos, bye.